Hi everyone. The FAME Toolkit is a wonderful new and thorough resource for school food allergy management. Today we'll be walking you through this toolkit, so thank you for joining us. This webinar is offered by Kids with Food Allergies as part of its Education Outreach Program. I'm Linda Mitchell, Vice President of Kids with Food Allergies, and I have the privilege of being your moderator today. Today's webinar is made possible through a sponsorship by Mylan Specialty. We rely on donors and corporate partners like Mylan for the financial support that enables us to develop educational programs for families. This webinar is of a general nature only and is not medical or legal advice. You should consult your own physician for any medical advice you seek with regard to food allergies and any other medical conditions. This webinar today is being recorded. We will be sending you a link to the recording in a few days, and it is archived on our website for later viewing. Presenters for all of our webinars are doing so as volunteers without compensation. I'm delighted and honored to have Kathleen McDarby, RN, MPH, Program Director for the Food Allergy Management and Education Toolkit at St. Louis Children's Hospital, and Dr. Michael Pissner, KFA Medical Advisor and co-creator of allergyhome.org, to be here with us to go through this toolkit. We're also running some polls for you to take while I'm going through this introduction. On behalf of KFA, I'm very grateful for Kathleen and Dr. Mike to donate their time to be here with us. Later in today's webinar, we will stop to give away 2 gifts from 3 of our corporate supporters, Sunbutter, Dr. Lucy, and Applegate. The recipients of those gifts will be picked randomly from those still in attendance later in the webinar. And when we end the webinar, you will see a survey. Please share your impressions with us, as we will take your feedback seriously to improve the future direction of our webinar series. And also today there's a couple questions to ask how you would like us to get information out to more people about the FAME Toolkit, so more school nurses and others who would find it valuable will be aware of it. And so now I'd like to turn the floor over to our 2 speakers so they can get started. Thank you for joining us today, Kathleen and Dr. Mike.
Thank you so much, Linda, for this opportunity. This is very exciting. I'm really very thrilled and happy to be able to share the Food Allergy Management and Education program with our audience. And again, this is a free resource that you will be able to access online, which we'll talk more about that in a little bit. So we're going to go ahead and get started. So the Food Allergy Management and Education, what you see on your screen right now is the dashboard that will take you to all the various sections within our FAME Toolkit and Manual. So this is an educational tool. It provides valuable information and resources to assist in the management of life-threatening allergies. All users who should begin with getting started, which you'll see on the screen, and then from there, everyone needs to know and understand emergency preparedness and how to respond, as well as federal laws and state laws that may guide how you manage children with food allergies in the school setting. And then from there, you want to go into specific sections depending on what your role is. So we all start with the welcome, and this will give you information on how you can utilize the information. So again, we want everyone to start with the instructions, how to use it, and then reviewing the emergency section as well as laws, as I said, and following various checklists, which we will go over shortly. There's a variety of modifiable forms that can be utilized in the school setting, and you can modify them for your own particular unique needs. And this shows you the various sections in the toolkit. So this is going to start telling you about food allergy, that it is immune system response, that antibodies are created for certain foods, and the symptoms can be severe and life-threatening. So this is how you would use it to educate yourself as well as others in the school setting or daycare setting. It talks about food intolerance, what that is, what the difference is between an immune response and food intolerance, and that these symptoms are not normally life-threatening, and that there are 8 foods that account for 90% of all reactions. However, any food can cause a reaction. And it lists what those 8 foods are. So it's very clear: milk, eggs, peanuts, tree nuts, soy, wheat, fish, and shellfish. So as we continue with the food allergy basics, most reactions are caused by ingestion, even a trace amount. Localized reactions can be caused by touch. Inhalation reactions are possible but rare, such as cooking fumes, peanut dust. And then dairy and milk allergies, about 80% of kids can outgrow them. And peanut and tree nut, those allergies typically are not outgrown, only 9 to 20%. And seafood allergy, there's usually no tolerance developed. And Dr. Mike can tell you a little bit more about the type of possible reactions.
Yeah, one thing while I have a chance to share with everybody is that I am one of the physician participants in the FAME group. And what's amazing about the FAME group is that this is a multidisciplinary team of folks from around the country who've been involved in school health and involved in food allergy and anaphylaxis education and advocacy work. And so Kathleen has led this team of all these folks in all our different walks of life to come together and to work on this toolkit. And so I am one of several physicians, but there's school nurses, there's leaders of the not-for-profits, including Linda, and then also other not-for-profits. There's parent representatives, there's administrators, there's teachers, and so and school nutrition, dietitians, you name it. And so all of us have come together with multiple meetings to be able to weigh in on this document. So I just wanted to kind of put that background there. But as far as what Kathleen was talking about the potential reactions to touch, skin does prove to be a very good barrier, but that's when it's intact. And one thing that folks need to know, and that's something that this toolkit also hits upon, is that young kids can put their hands in their mouths, nose, eyes, and so what could be a contact reaction could very easily turn into an oral one. That's where most of the reactions occur with oral ingestion. Inhalation is also something that can happen, and that smell that we smell when somebody's eating a Snickers bar, that's actually caused by a volatile organic compound. That does not in itself cause a reaction, but when the proteins are aerosolized, whether it's by active cooking, grating, smashing, crushing, and then get put up and in a vapor, that is when there's risk. And the nice thing is that in the school setting, those are very preventable as long as people are educated, and that's part of what this toolkit does.
Thank you. And in our manual, we have more information that gives a little more details than the sections in the toolkit. So this is out of our manual, and it begins with what is anaphylaxis. So it explains and defines that anaphylaxis is an emergency, it's rapid, it's a severe allergic reaction. When the allergen enters the bloodstream, the body releases many chemicals to protect itself from the allergen, and again, this is an adverse immunological response. These chemicals can cause dangerous symptoms, including breathing difficulty, swelling, dizziness, low blood pressure, shock, and death. So again, these are potential signs and symptoms of an allergic reaction. And it goes through the various body systems and what those reactions can be. And Dr. Mike's going to talk a little bit about what children may say or how they may react with their signs and symptoms.
And this is especially relevant for those folks who represent elementary school and preschool settings where the younger kids may express themselves in different ways than an adult or an older child would. They may, in the case of my own son, when he had his reaction, he said he couldn't get the taste out. Kids might say they have a frog in their throat, they're itchy, it burns, their teeth hurt. So these are things that all folks who are caring for these students should be aware of. And if that in itself isn't what somebody can know for sure, at least it gets them thinking, I need to start thinking about a potential allergic reaction here.
Thank you. So we also talk about who is at risk for anaphylaxis. And we know that a person who has, or a child that has, a severe allergic reaction in the past, if they're allergic to one of those 8 common foods, and in addition there's potentially life-threatening allergies to insect sting venom and medications as well as latex. So these are some of the various severe allergic reactions that can occur if they're allergic to any of these things. So some of the other risk factors for anaphylaxis is delay in epinephrine administration, and some of the sayings that we like to provide and help people remember is when in doubt, give it out. And that asthma and food allergies, if a child has both, then they both can have a more severe reaction to their food allergies as well as more severe asthma. Not reading food labels, which I'll talk about a little bit more depth, cross-contact or cross-contamination, peanut and tree nut, decreased awareness of roles and responsibilities, and that's why the toolkit is divided up into all those various roles so that everyone knows what their responsibilities are. Not knowing signs and symptoms, reactions are unpredictable, and all symptoms need to be taken seriously. Many of the most severe reactions do not present as hives. And as I said, there's other life-threatening allergies. And all this information is within the toolkit and manual.
And if I could just jump in here, Kathleen, if I could just jump in here, that actually kind of sets me up to be able to just kind of pass along one really important thing that this toolkit kind of helps the schools pull off. Which is really the principles of food allergy prevention and emergency preparedness. And ultimately, it can help people be prepared in all settings in the school, no matter what their role is, and no matter the age group of the kids. And that's ultimately what you're going to always want to keep in mind is these prevention and then the preparedness strategies that need to be implemented at all times and in all circumstances.
Right, very good. So within the emergency preparedness and response section, we have a checklist on how to prepare to make sure that your school is prepared for an emergency. If you would have a reaction, what is the response? And then if they have a reaction, doing a follow-up and debriefing, which is extremely important. You can have a lot of things in place or think that you have a lot of management strategies in place, but we all know that something can go wrong. So we need to talk about that. And then we have all the various epinephrine auto-injectors, how to use those. And we have a competency, it's a checklist and a test as you instruct your staff on how to give and utilize these auto-injectors. You can actually go through and demonstrate to them and have them demonstrate back. So showing you what's inside, again, the emergency preparedness, and this is the checklist. So this is the information that you want to make sure you have and the things that you need to do to prepare for an emergency. So you want to develop a response plan. And if they do have an allergic reaction, so what is the steps that you want to take? So you quickly want to recognize and respond. and treat a reaction. And things to consider if an emergency does occur, you want to know who's going to stay with the students and the classmate, who's going to activate the emergency response by building or by the entire system. Who's going to notify your emergency medical services? Who will notify school administration, the parents, the guardians? All these things have to be considered when you're developing your management and emergency response plan. So again, you want to have the epinephrine immediately available, call 911, remaining with the student, placing them in a reclining position or raise their lower extremities, and contacting the parents. So this is a step-by-step, right up front, what needs to be done in responding to an emergency anaphylactic reaction. Anaphylaxis, the symptoms can begin within 5 minutes to 2 hours. So this is something that you want the school staff to be well trained in recognizing the symptoms and responding, because over 50% of fatalities can occur within the first hour. And then there's something called late phase or biphasic reaction, and that can occur within minutes to 4 hours or more after the initial reaction. So that's why you always have 2 epinephrine auto-injectors available. And they must go to an emergency department in order to be observed. And you can give that second dose within 5 to 15 minutes. So epinephrine, what we say is it's the first line of treatment for anaphylaxis. When in doubt, we give it out. Not giving epinephrine. Yes.
Hi. We got a comment from Jill Midland, who wanted either you or Dr. Mike to address the fact that you shouldn't put someone in a reclining position if they're vomiting. If you could just comment on that.
Yes. You want to make sure that they are not having any kind of gastrointestinal issues, no, as you're saying, nausea and vomiting. If they do, you would want them on their side. You want to make sure that they do not aspirate. So that's exactly correct. One of the symptoms, possible symptoms of a food allergy reaction is gastrointestinal, nausea and vomiting. So thank you very much for that. But again, with epinephrine, and we teach this throughout the toolkit and manual, that it is the drug of choice for an anaphylactic reaction, and that there are no real true contraindications, and it should be quickly accessible wherever that child is, at sporting events, before and after school care. And Mike, do you want to talk a little bit more about the medication, epinephrine?
Yes. So so the auto-injectors, as Kathleen said, should be available, and so this way they'll be accessible in the event that there is an allergic reaction. They should be kept in a secure but unlocked area where people who need to use them to treat the children have access to it. Now, the healthcare provider giving the prescription will choose one of 2 doses. There's a lower dose, the 0.15 milligram, and the higher adult dose, the 0.3 milligram dosing, and this will be chosen by the prescribing provider. And then in some schools, in some states, there are now laws where kids who have not had a prior diagnosis and do not have their own auto-injectors available can be given stock auto-injectors. And here a prescribing healthcare provider who is providing health services to the school will write standing orders for the availability of epinephrine in the case of a child without known or who doesn't have their own epinephrine available.
Thank you. So within the toolkit, we have these how to use an EpiPen auto-injector, and I'll show you the other ones. And again, it'll go step by step on how you would administer with that particular auto-injector. It also gives the message, calling 911 immediately. The children must be observed in the emergency room if they are given an epinephrine dose, and that the second dose needs to be available. So where the site is and how to give it. So this is the one on how to use an AviQ auto-injector with the information step by step how you utilize the auto-injector, and again those other important messages about calling 911 and having second dose ready. And this is the AdrenaClick, which also is comes in a generic form, and this is how to use the AdrenaClick auto-injector. So those are the three that are currently on the market, and if more come out on the market, we will also create these educational tools to put into the FAME information. So this is a education sheet that is in the toolkit, and this can be printed out as a poster, which I have done many times in a large 11 by 17, and then laminate it, and it can be posted in appropriate or various areas in the school. So this sums up a lot of the information that we just went over. What are those 8 most common food allergens? Knowing the difference between food intolerance and a food allergy. What is anaphylaxis? And what does it look like? What are the signs and symptoms? So some of those words that children may use, we put on this poster. So some of the things about, a tight throat or my tummy's aching, to make it very clear and uncomplicated for the school setting. And then again, the key message, in case of a reaction, give the epinephrine, call 911. And again, note, any food can cause a reaction. So within the toolkit and manual, there's information on federal laws that can pertain to children with life-threatening allergies and also within the school setting. So there's the Rehabilitation Act of 1973, which is also known as Section 504, a federal civil rights law. I'll go into that a little bit more detail when we talk about 504 plans. There's the Americans with Disabilities Act, Individuals with Disability Education Act, 1976 IDEA, VERPA, Family Education Right and Privacy Act of 74, the Food Allergy Labeling and Consumer Protection Act of 2006, which I'll talk a little bit more detail about that as well. Then there's the Substitution or Modification School Meals, which is a USDA Regulation 7. And the School Access to Emergency Epinephrine Act that was just passed last year. And that is, the law encourages states to allow schools to have stock epinephrine for children or adults who may have a reaction but do not have a prescribed specific epinephrine auto-injector. And then the Food Allergy and Management Act that was passed in January of 2011 resulted in the CDC developing voluntary national guidelines for managing food allergies in schools and early care and education programs. And Dr. Mike's going to talk to you a little bit more about the CDC guidelines.
So those guidelines are absolutely phenomenal. Now, for the states that already have state guidelines, ultimately the policies are going to be mainly coming from state guidelines, but these voluntary CDC guidelines are so helpful, especially in the states where they don't have state guidelines yet. Now, they guide schools in the management of food allergies. Experts experienced in school health and also the management of food allergies and anaphylaxis contributed to this, and it really makes an awesome foundation to implement school policies so you don't need to be recreating the wheel. The way it's also written and put allows for variation in implementation. So an elementary school, a middle school, a high school, a school that goes from K through 12, this is usable by all of these, even though each of these schools has totally different resources. Now, there's 5 priority areas in these CDC guidelines, one of which is the appropriate food allergy management must be implemented for individual students. It also drives home the importance of being prepared to deal with allergic emergencies. It also deals with staff training and professional development, which is so incredibly important to be able to help the eyes and ears of the school nurses. It also drives home, and this is something relatively new in guidelines, is the importance of educating students and families to be able to support the kids with food allergies. And then it also drives home the 5th priority area is that educational environments are healthy and safe.
Thank you, Dr. Mike. I want to take the opportunity here to talk briefly about the National FAME Advisory Board. As Mike said earlier, he is on the board, as well as Linda Mitchell, our host, and many or several of the panelists who are on the panel for the development of the CDC Voluntary National Guidelines are also on the FAME Advisory Board. This board has been absolutely phenomenal in giving their time and their expertise to develop this, and have really been extremely collaborative. And as Mike said, multidisciplinary. So we have each one of those sections, each one of those stakeholders were represented on the FAME board. So the federal law that I wanted to talk a little bit more about to show you as an example what is in the Toolkit manual is the Rehabilitation Act of 1973. It's a civil rights law which is commonly known as Section 504. And what this law does is to ensure that any child that has any kind of handicap or disability would not be excluded from participating in any of the educational programs or other programs that a school that receives federal financial assistance would offer. So this will provide the management strategies and also the insurance that these children will be able to participate in the school activities. So as we move along to the healthcare professional or the school nurse section, there'll be more information on the 504. So this school nurse section is really our largest section within the toolkit. It has most of the information so that the school nurse can, and usually is the point person in educating the staff on life-threatening allergies, also with identifying the child that has the allergies and creating that management plan. And we'll talk about the different health plans that the school nurse usually develops. So there's emergency preparedness information, the specific checklist for the school nurse's role, various forms that are samples, and they also are modifiable, and education and training materials. There's forms on self-carrier authorization, so if the child is at appropriate age, appropriate cognitive level, they may be able to be trained on how to self-administer and carry. And then information on field trip risk assessment, and that's an important preparedness for going outside of the school setting. So within the healthcare professional section, there's the information on all the what we call an intake, so the student health records and all the various forms, the health history. There's also information on the medication authorization, Team development, so an emergency care plan or a food allergy action plan if meal substitution is necessary. The education and training of the staff, as Dr. Mike said, it's extremely important that all staff are trained in signs and symptoms of a food allergy reaction, how to read food labels, and also medication handling. Is it accessible? As Mike said, it needs to be in a location that the school nurse can obtain or the teacher or others who are trained on how to give an epinephrine auto-injector. Review preparedness, training, and the policies. Those are really important for all the various teachers and other staff. So this is an example of a student health history, and again, it is modifiable. You can use it in your school setting. We have a section for allergies that will specifically able to check if it's an environmental, if it's a food allergy, if it's a latex, medication, or insects, and more information on what their signs and symptoms are. So I really like this is another additional modifiable form. It's an allergy history. So if on the student health history it's checked that they do have food allergies, this form can then be used for the school nurse and school staff to get some real specific information about that particular child. So what they're allergic to, and if they've had a reaction, what the signs and symptoms, what was it like? Have they ever had to use an epinephrine auto-injector? Have they had to go to an emergency? And do they have their care plan? So this will really help the school nurse and other staff guide how they manage that particular child. So those are the signs and symptoms of a reaction. This is a food allergy and anaphylaxis emergency care plan. So these are one of the forms that can be used for the child with the life-threatening food allergies. There can be other forms, but this one is from the Food Allergy Research and Education Organization, FAIR, and it's a really helpful form. I think it's easy to use. It gives you the directions under the severe symptoms and the pictorials of what those symptoms may be for the lungs, the heart, etc. And if they have those severe symptoms, you want to give them epinephrine immediately. And the physician or healthcare provider fills that out, and it gives the school nurse and others in the school, as well as the parents and family, directions on how to treat a reaction.
Kathleen, if I could jump in here.
Yes.
These emergency care plans, especially for I think it's about 60% of the folks who are joining us today are school nurses. We're preaching to the choir here about the importance of these. One of the things that we all need to remember, especially physicians who are filling these out, is that what's so important is that they're written in a way that appropriately treats anaphylaxis, and that is with the first-line medication epinephrine, and that they're written in a way that a non-licensed person would be able to follow these directions and give the epinephrine. So they should not only be written for school nurses, but also written in a way that the delegates, the folks who the school nurses train, will therefore understand when it is that they need to be given the epinephrine. And for sure, any symptoms that suggest anaphylaxis need to be treated with epinephrine. So therefore these emergency care plans are really critical. So getting them on anyone who you know has a diagnosis is going to be really important.
Right, and to add to that, this form again should be something that the parent has, that any kind of other caregivers, whether it be a babysitter, grandparents, an aunt, whoever is going to take care of that child really needs to have this food allergy and anaphylaxis emergency care plan to help direct them on what to do if the child has a reaction. So on the back of this form, it gives information again on the 3 auto-injectors. Just a quick reminder of how to use the various auto-injectors. Those other forms are really helpful in learning in detail when it's not in an emergency situation how to give the various auto-injectors, because when we're in an emergency situation we get anxious, we may hurry and just not be thinking straight. So this gives you a little bit of a reminder during the emergency, but really need to take the time to learn how to use each one of those auto-injectors. We also have in the toolkit instructions to complete an individual health care plan. So the school nurse would develop an individual health plan for a child that has life-threatening allergies. And we give the step-by-step instructions. We also have a sample individual health plan that can be completed by the nurse. It's a modifiable PDF. But what's nice about having the instructions is you can see just easily, I know the school nurses know what to do, but this just gives you a step-by-step kind of easy reminder of the information that you need to gather, the medical overview, the medication, the side effects, any other information, medical history, social and emotional, as well as academic. And then the 504 plan, I talked a little bit about the federal civil rights law. If the family can request a 504 evaluation, that is their right to do. And I know there are some school districts within the St. Louis metropolitan area, as well as around the country, that as a policy will develop a 504 plan for a child that has a diagnosis of life-threatening food allergies. It's not something that every child necessarily has to have, but it is an option. And again, parents and guardians do have a right to ask for a 504 evaluation. So if they decide to have the 504 evaluation, this gives a step-by-step instructions on how to go through that process. And again, the information we have in here is based on the CDC voluntary guidelines. So again, the National Advisory Board developed this flow chart to help walk us through the process of developing a 504 plan. They did a fantastic job. So the first step is you want to identify your role. So specifically, is it the parent guardian? Is it the healthcare provider, the physician, nurse practitioner, allergist? Is it the school nurse and the 504 coordinator? And they easily go from step 1 to step 2. So as an example, if it's the parent, you want to request and obtain the emergency care plan from the child's healthcare provider, their doctor, their allergist, or the nurse practitioner. And then determine, do they need to have school meals? They need to contact the school and request a 504 evaluation. So that gives the parents a step-by-step of what they need to do to begin that process in developing a 504 plan. And they can check off as they go down the line. And then it gives information, same type for the physician. A lot of physicians, healthcare providers in the community aren't really sure what would need to be involved in a 504 plan. What are all these accommodations? So the school nurse and the 504 coordinator, the same thing. And then the next step, step 3, is the student going to have a 504 plan? Have they been approved? If they have, then you start that process with scheduling the meetings. If not, then the family will work with the school nurse, developing the individual health plan. And there's actual resources that you can go to find out more information on the 504 plan and developing that. So if you're determined you're going to have a 504 plan, what are those accommodations? And again, this is just a nice visual, easy way to determine what are those accommodations. There's some general accommodations that every child should have. So all staff in the school need to follow the food allergy policies. The school nurse will educate and train staff. The student will have the epinephrine auto-injectors, making sure that events, field trips are consistent with food allergy policies. So there's some general information. And then we go down to some specifics. Emergency accommodations, what are those? We need to think about transportation. Does there need to be accommodations? Classroom accommodations, and then celebrations. How are we going to celebrate? Are we going to celebrate with food or non-food items? So those are some of the things that need to be considered when you're developing a 504 plan and talking about accommodations. And Dr. Mike can talk a little bit about the classroom accommodations, why we need to have those.
Well, one of the things was this particular tool was created to help smoothly get this process going, and it is based on, these accommodations are based on the CDC guidelines. So in a sense, it makes it so these voluntary guidelines then can be implemented in the structure of a 504. So now what Kathleen is kind of left off to here is in the classroom, things that are going to ultimately want to be taken into consideration are the developmental capacities of the children and then also the resources of the school. And this is really the case when implementing policies, any policy and in any school. If you have the young children who are exploring their environment with their hands and their mouths, then we're going to have risk of exposures that will go from these cross contacts and into an oral exposure very quickly. Little kids between the ages of 2 and 5 put their hands in their mouths in one study up to 40 times an hour. Adults put their hands in their nose, eyes, or mouth 15 times an hour. So here in the classroom setting, if children are eating in the same setting where they're learning and playing, then that can be something where cross-contact exposures are going to have to be taken into consideration, and then there will need to be ways to decrease that based on the resources of the school and the developmental capabilities of the kiddos.
Dr. Mike, I just want to interrupt. It's about 1:45, and I know both of you have a lot of slides to go through, and we've been getting a lot of questions coming in, so I'd like to leave at least 5 or so minutes for questions. So I just wanted to let you both know that.
Okay, thank you. Yeah, we can go through these rather quickly. So that was a flow chart that really helps go through that process, and then there's the forms and modifiable PDFs that you can use to complete the 504 plan. And again, this is a sample 504 that would go with the child's record. So this is a field trip assessment form, and again, this is in the toolkit, and it's to help plan for the field trip and preparing being out of the school setting. So thinking about what kinds of food will be provided, is the activity itself involve food, how will the lunches and snacks be prepared. This is a medical statement request for students requiring special meals. What we've done is we have the modifiable PDF, but we also have the sample filled in, so it's really clear what information is needed to have the special meals planned in the school setting. So you have to have a diet prescription, the type of foods that are omitted, and the types that can be substituted. So we have the section for administrators, principals, and teaching staff, and also in this section that the National Board just developed is a checklist for school board members that gives them information on what is needed by the school board to set the policies for managing these children in the school setting. So I'm really excited about that particular checklist that was just developed. So again, each person within the school setting, they need to know about the emergency preparedness and response. And specifically, there's specific information that administrators need to do, teachers, and other support staff. So we have the teaching staff checklist, creating a partnership with the children and their families, obtaining those written instructions from the school nurse or the physician, having that emergency care plan, and that they would be trained on avoidance strategies, possibly how to use the auto-injector, and other management strategies such as avoiding food in the activity or lesson plan, planning ahead, discouraging sharing and trading of food, washing hands. These are all management techniques and strategies that are used in the school setting. We also have a section for support staff. So that would be your coaches, your lunch and recess monitors. So we really want to emphasize that everyone has a role in managing children with these life-threatening allergies. So these are all the support staff, and they each have their own checklist. When we talked about the federal laws, in 2006 there was a food labeling law passed which identified the major allergens had to be declared, so one of those 8 foods. They had to use simple terms like milk instead of caseinate. They had to identify which nuts, what kind of seafood, and then something that was not really regulated was the may contain statements. And that's processing food in a facility that also processes, say, peanuts or dairy. So this is our how to read a food label. So it's extremely important that everyone learns how to read the food label. So we have avoid those foods and non-food items that have advisory statements on labeling. So we also have how to read and label for peanut-free diet. And we have one for all those 8 major food allergens. And again, this is an example of what you need to look for. So this casein is actually, excuse me, in dairy. So you have to make sure that you read every line every time. Another saying I like is, if you can't read it, don't eat it. So the next one is on the food labels. And you can see that food labels are really not easy to read. But it's extremely important that, again, you read every line every time. Excuse me. And they are supposed to take out and put the common words wheat, milk, and soy ingredients. But they don't necessarily always do that. So another management strategy is to avoid cross-contamination or cross-contact. So we have another poster that's really, again, very easy to read. It can be printed out as a poster, or it can be used as a handout in your education. So how to avoid cross-contact and cross-contamination, realizing that there's hidden allergies in food, and again, the messaging, if you have an allergic reaction, give epinephrine, call 911. So these talk about some of the sources and also avoidance strategy, so hand washing, not sharing food, and some of the hidden allergens. And then we have information on food allergies, self-image, and social factors. Again, this is an educational piece. It can be used on one-on-one education. It can also be used as a poster. And Dr. Mike's going to talk a little bit about the food allergies, self-image, and social factors.
And this is an important thing that this toolkit helps support, which is getting to support these kids for the emotional and social piece. And it is known that 35% of kids over age 5 has been bullied, teased, or harassed because of their food allergy, and giving folks the ability to communicate the social needs, the emotional needs to the staff, everybody dealing with kids with food allergies is really important.
So the parent-guardian section, it has a lot of the information that I had just talked about, a lot of those same forms, but it has some things that are specific for parents and guardians as well. And they have a checklist. This is to help them determine what are some of the things they need to bring to the school, that they need to talk to the school staff about to keep their child safe. And there's parents frequently asked questions form to help them when they go to the doctor or when they need to talk to the school. So, is my child safe at school? These are one of the issues that the parent has when they take their child into the school setting. There needs to be open communication between the parents and the staff. They need to submit the paperwork and the medications that we talked about. And one of the things that I really like about this form is if you see in the center, the child with the food allergies and life-threatening allergies is who we are here for. And all of us staff that are there to make sure that they have a safe environment. This is another information for the parents that was developed by along with our board, which instead of giving you a letter, it gives you information on how to write a letter to your, could be your school board, to your healthcare professional, to the administration. And we have information for students who have food allergies, things that they can do to help themselves. And again, it's going to be age dependent, where they are, you know, their cognitive level. But at some point, even starting very young, they need to know what foods are safe or unsafe, what they're allergic to. They need to be able to talk to an adult if they're having any kind of symptoms or issues. And then emergency preparedness checklist. We've taken that same information but boiled it down really on a child's level and some of the things that they can do to help keep themselves safe. So learning about allergic reaction, asking for help when they need it, what they do if an emergency occurs. And then their classmates also need to have information and education about food allergies, what they can do to assist their friends, what they can do for prevention, not taking any food allergies lightly, knowing that their schoolmate is just like them except they have food allergies, not to do teasing or bullying, and talking about various kinds of celebrations without food. And this is a education sheet that can also be a poster, and it talks about really fun ways that you can celebrate and reward children without foods. And this is an education sheet for a younger child that the parents can work with them to educate on their food allergies, as well as the school nurse or the teachers. And we have information for tweens and teens in particular. So some of the things on how they would avoid allergens in the lunchroom, since they are in a more opened area, they have more privileges. Vending machines, eating away, eating out, traveling, wearing medical alert bracelets, behaviors with their friends. They tend to, at this age, have a little more risky behaviors. Kissing, Dr. Mike talked about our hands everywhere. Well, with tweens and teens, they have more than hands everywhere. And messaging that they're not alone, they need to carry their EpiPen, they need to speak up about any kind of teasing or bullying. And then we have some resources that are specifically for the tween and teen. We also have in there resources for the school nurse, parents, and others, that we have like 4 pages of additional information and websites that you can go to. So Mike, did you want to give them any more information?
I think we probably have some questions to address. Linda, if you got any of those.
So do you want to go ahead with the questions?
I forgot to unmute myself. I'm sorry.
Okay.
We had a few ask about the emergency care form and how it refers to Benadryl for mild reactions and how to deal with that in a school setting.
With the food allergy action plan?
Yes.
So the food allergy action plan, it will direct what medication to give when. And the school nurse, if there is a school nurse, the school nurse will be able to make that kind of assessment, whether it's a life-threatening reaction or a mild reaction. But again, learning and understanding the signs and symptoms of an anaphylactic reaction is utmost important, and knowing that the only medication for an anaphylactic reaction is epinephrine.
And so one of the challenges is that depending on the provider who's filling out some of the emergency care plans, at times some may have antihistamine on there, some may choose not to, some may inappropriately use antihistamine for symptoms that shouldn't be. And this is going to be where parents and especially school nurses are going to want to take a look at these emergency care plans before they actually go in to their staff, to their delegates, make sure that they make sense, and also make sure that they work with their state laws and their school policies, because as many of you know, certain states, non-licensed people cannot administer diphenhydramine, cannot administer the other antihistamines, and people need to know that when they're ultimately training the delegates and others off of these emergency care plans, and we need emergency care plans that work.
Okay, great. Should epinephrine be kept in the classroom as well as the nurse's office?
I believe that it can be kept in both places. Again, it would have to be in a safe place that the children cannot have access to, but the teacher could have access to. And again, it's going to depend on the school district, the school's policies. The teacher can be trained, and if they're adequately trained on how to recognize the signs and symptoms, how to administer epinephrine, it could be in the classroom, as well as it could be in the cafeteria, it could be in the gym. So depending on the school setting, their policies, and again the level of training that the staff has, it can be in other locations besides the school nurse office. Dr. Mike, do you have anything to add to that?
Yeah, taking the resources of the school into consideration is going to be really important. If you have a massive school that has 3 floors and it takes 15 minutes to get from one place to the next, then there's going to need to be access to epinephrine that is close by. If you have a very small school where the nurse's office happens to be right on top of all the places where the students are, then that's going to be something else. And so again, taking those resources and even the physical layout of a school into consideration is going to be important.
Thank you. I know it's 2 o'clock, and I know there's still a lot of questions, so I wanted to just wrap up with some important things. And Dr. Mike and Kathleen, if you're willing to stay a few more minutes, I can field a few more questions for you to answer. I wanted to make sure that we announce the winners of the giveaways. For the Applegate giveaway, we have Ann Regan and Donna Glover. For Lucy's giveaways, we have Heather Eastburn and Lucille Winslow. And for Sun Butter giveaways, we have Paul Sclaru and Sylvia Kalich. So we'll be in touch with you to make sure we get these items to you. And then also I wanted to make sure we got a lot of requests for where can I want this, where can I get it? It's at stlouischildrens.org/FAME FAME. And we'll be following up an email with all of you to give you a link to that. So I wanted you to make sure if you do need to leave at 2 o'clock that you have that information. And now if you're willing to take some more questions, I'll go back to some Q&A.
Yes, this is Kathleen, sure.
Okay.
Dr. Mike, are you good?
I'm in.
Okay, I have a little bit of a long one to read from, I believe it's a school nurse. When it's a time for this question, the biggest question we have as a school district, that barring any specific healthcare provider opinion on an individual case, how much and for how many years, i.e. the age of the child, do we need to be highly concerned about topical contact of allergens turning into oral contact and causing anaphylaxis? And specifically, how much more of a concern is this for peanut and tree nuts versus other allergens? And then what role does hand washing have to do with all of this, and peer-reviewed journals, so that we don't create too much hysteria?
Well, this is Kathleen. I'll say the hand washing is extremely important. Soap and water. You can use wipes. However, the antibacterial gels will not get rid of the protein. So good old soap and water or other kinds of commercial wipes, and they really do need to wash hands before and after eating. And also the surface and area where they are eating needs to be cleaned with the proper cleaning agents. Soap and water or commercial, and again after and before that child would eat on that particular area.
And again, as the question kind of hit at, that developmental age is going to be key with the little ones who are exploring their environments with their hands and their nose and their eyes and their mouths. A skin exposure can very quickly turn into an oral exposure, and really preventing any exposure is going to be key. So cleaning strategies and knowing resources and knowing the developmental capabilities of these kids is going to be really important. So in a high school population where these kids can read labels, where these kids can wash their hands in an effective way, and that's going to be one thing. But then when we have little kids, we can't expect them to necessarily be very competent in their cleaning strategies. If you ever even watched my my fourth grader wash his hands, then that could be questionable. And so these are things that we're going to want to keep in mind.
Okay, great. Also, in the follow-up email you'll all receive, we'll include a link to Dr. Robert Wood's hand washing study, and well, it's actually for cleaning surfaces and hand washing, so that you have a study results regarding which items are clean peanut off of surfaces and hands and which don't.